At Midi, we work with you to prescribe what's best. Sometimes that's hormone replacement therapy, because a wealth of research shows it's the most effective way to address many symptoms of hormone transition. But that doesn't mean every woman should take hormones or wants to. What are some reasons to consider other non-hormonal treatment options? If you've ever had a stroke or an embolism, if you have certain types of heart or liver problems, if you've had cancer that might be stimulated by hormones, including certain kinds of breast or uterine cancer, or if you're currently dealing with unexplained vaginal bleeding. Whether you can't take hormones or just prefer not to, Midi offers you options and alternatives, ranging from non-hormonal medications to supplements and wellness therapies. Non-hormonal prescription meds are effective against hot flashes and work well when given in very low doses. For example, high-quality studies show excellent results for low doses of SSRIs, usually prescribed for depression, and gabapentin, used for nerve pain. And then there are lifestyle changes and wellness therapies backed by solid evidence. Simple diet shifts can be transformative. There's good data behind cognitive behavior therapy, and mindfulness, or just taking time to focus on your breath, is less proven but worth trying, because it benefits so many aspects of your health. Acupuncture, yoga, hypnosis, and Tai Chi all need more study, but many women report feeling better when they integrate them into their daily routines. Finally, let's talk about supplements and botanicals. These can also be very effective for treating symptoms including hot flashes, mood changes, and sleep. We may recommend them instead of prescription meds or alongside. It's all part of personalizing your care plan to you. Some botanicals with strong evidence include black cohosh, maca, St. John's wort, lavender extract, and ashwagandha. Midi tailors recommendations based on your symptoms and the benefits and risks for you personally. Our care is rooted in science, and we make decisions with you, not for you. That way, you'll feel as confident in what you're taking as we do.